Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Good morning, everyone. Namaste. I am Dr. Biswamohan Mishra. I am MD in Medicine, DM in Neurology. Did my DM Neurology from AIMS New Delhi. After that, I was a faculty there for 2 years, and then I have recently joined here as Assistant Professor in Neurology in KIMS Hospital, Bhuawaneshwar.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
See, basically, the brain uses tiny electrical signals to control everything we feel, think, and act. When the brain is overloaded by these electrical signals, so say a flurry of these electrical signals, which the brain cannot handle, then the patient will have a seizure. Some people describe this seizure as a storm inside brain or a brain on fire. And during a seizure, a patient may move shakily his limbs, or may convulse, or may lose his or her consciousness, or there may be a sudden feeling of fear or panic.
What is epilepsy?
Yeah. Epilepsy and seizure are a little bit different. When a patient is having two or more seizures in 24 hours without provocation, see, provocation means if the patient is having any brain infection inside brain or there is a tumor inside brain, that will provoke a seizure. But when a patient's MRI brain is normal, still the patient is having two or more seizures, then it will be called an epilepsy, and that too within 24 hours. And this is not caused by something like fever, infections, tumor, or severe head trauma. Then we will call it as an epilepsy. And epilepsy can include different types of seizures. And so some people may have one type of seizure, and some people may have a combination of two, three types of seizures.
What are the different types of seizures and do they affect people differently?
The seizure types they vary differently. In a single patient also there may be two three kinds of seizure. Most people will have a single kind of seizure, but people may have two three kinds of seizure. Seizures are usually classified into two types. One is a generalized seizure, one is a focal seizure. When the entire brain is affected by those abnormal electrical or a surge of these electrical activities, then the patient will have a generalized seizure. When these excessive electrical activities are affecting a single or a specific part of the brain, then the patient will have a focal seizure. So now a patient can have a combination of either generalized seizure plus a focal seizure or different types of focal seizures plus a generalized seizure.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
See, in 50 to 60% or in more, the exact cause of epilepsy cannot be found out. And we call that as idiopathic generalized epilepsy. And in the rest 50% of the cases or 40% of the cases, we usually find a tumor inside brain or some infection inside brain, or there may be a history of brain injury. And in elderly patients, say above 65 years of age, when the brain becomes atrophic or the brain shrinks, that can also cause a seizure, like Alzheimer's patients with dementia, Alzheimer's disease, and those with strokes, brain strokes, they can also have a seizure after 65 years of age. But in majority of the cases, it is very difficult to identify what the cause of the seizure. It is because it is just an electrical activity inside brain. There may not be an abnormality inside brain, just an electrical abnormality. So may not be able to find a brain, but that doesn't mean the patient doesn't have a seizure. So he or she has to take medications, irrespective of whether the cause is found out or not.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
When a patient is having a seizure, the patient, one side of the body or the entire body, the hands or legs or even the trunk, they may shake violently, uncontrollably, or the patient may have a convulsion. We call it as a convulsion, uncontrollable shaking of the body. Some patients may just stare into the blank space, which is called an absence epilepsy. Some patient may have a shaking of the one arm only, one hand, one leg, or a twitching movement of one part of the face, let's say right side or the left side. That is a focal seizure. Or some patients may have just a strange feeling, like a aura arising from the stomach, or some kind of fear or panic, which is called a focal aura before starting of a seizure. So these are the type of things a patient may experience while having a seizure. And some patients may lose consciousness after having a seizure. Some patients may not lose consciousness. So people must be aware of these things, the symptoms.
Now let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Unfortunately, for a very long time, epilepsy has been misunderstood as a evil disease. Many people in tribal areas, recently, one of my patient also, after he being admitted, he was saying that I will go to a tantric in my tribal area. So this has been misunderstood as a stigma or a evil disease for a long time, and because the seizures can look very frightening, somebody is shaking very violently, people will become frightened, so they may associate it with some evil thing or some ghost capturing one's body, and that leads to stigma. And regrettably, individuals with epilepsy may face negative attitudes and discrimination from others. The negative attitudes may be reflected in the form of reluctance to providing job to them, reluctance to marry them, or allowing one's own children to go near children who are having epilepsy. And these things, these stigma things, they may in fact exacerbate the epilepsy, because stress and too much of stress and this social isolation and discrimination, those things may lead to more of a trigger of a seizure or epilepsy. That's why communities need to be aware of these things, that it is a neurological disease and it is a highly treatable disease if timely treated, rather than believing in myths and all those evil things. Better to consult a doctor and get treated.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
So, triggers usually differ from patients to patients. Some patients may not have a trigger at all, but the usual triggers that we see in our day-to-day life or what are described in the textbooks are that if you are missing a sleep, you are having inadequate sleep, say 3 4 hours per day, that may precipitate a seizure inside the brain. And if you are having a high level of stress, if you are skipping meals, there are some flashing lights like you are watching a movie which has a bomb exploding, which causes a sudden flash of light. There are many games which children usually play with high FPS. FPS is frames per second. So there are high FPS so that the frames move very fast and the lightnings are very high, bright lights are there. Those things may trigger a seizure. Otherwise, patients who have a tendency for seizure, if they are having any fever or a head injury, that those things can also trigger a seizure. And in women, especially during the menstrual cycle, the hormonal changes they may trigger a seizure. So these are the things that can trigger a seizure.
Thank you so much, Doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
So what happens is during, as we discussed, during a seizure, a patient may not be conscious about himself or the surroundings. So it is important to take safety measures so that he or she doesn't injure herself. Especially if you can remove the obstacles which are usually around the patients who are having seizures. And we advise patients who are having seizures to avoid driving at all, not to drive whether bike or car. It is better to avoid driving and those things which can endanger your life. Like if you are swimming and at that time you are having a seizure, then that can endanger your life. And also going near bonfire or balconies of high-rise buildings, there also you have to prevent going to those places, so that if you are having a seizure at that time, you will not endanger your life. Plus, as we discussed, if you can identify the triggers which are causing the seizure, and if you can note them down and try to avoid those things, then you will be safe and you can prevent seizures to some extent.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
So just remember that any patient with seizure, uh, kindly consult a doctor as soon as possible. And one practical thing I would like to say to my viewers, we have experienced in our day-to-day lives that many patients with seizure, when they see someone having a seizure, they try to forcibly open their mouth or extend their hands, open their closed fists, which may actually harm the patients or harm those who are doing it. Please don't try to do this. And many people, they want to give some water or some liquid inside the mouth by forcibly opening them. That will only increase the chances of having a infection inside brain and causing death to the patient. So if a patient, you are seeing a patient who is having a seizure, do not panic, be calm, and try to keep the patient in one of the lateral positions like left lateral or right lateral position. Do not try to forcibly open the mouth or extend his hands, and see if the patient, most of the seizures, they will subside in 2 3 minutes or 5 minutes. If that is not happening, you can try to reach to the nearest hospital as soon as possible. And if the seizure is getting over in 2 3 minutes, then immediately consult a doctor or a neurologist nearby. And if possible, try to maintain a healthy lifestyle. There are no such things which can definitely avoid having a seizure. But if you are maintaining a good healthy lifestyle, then that is preventive for many diseases, including triggers, including seizure. And once you are having a seizure, do not stop medications without consulting a doctor, and try to avoid the triggers. And remember, you are not alone. There is a community to help you. You can get those communities in many social platforms like Instagram, Twitter. They will help you with that. And doctors and neurologists are always there, epileptologists are always there to help you in this aspect.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.